Hey there. Welcome to the Made for More podcast, presented by Adventist Health and Rideout. This podcast is dedicated to the people, stories, and mission that drives us to go beyond. Because at Adventist Health and Rideout, we believe that we're all made for more. For our very first podcast, we are so honored to have Chris Champlin, President and CEO of Adventist Health and Rideout. Today, we'll dive into his journey in healthcare, the exciting future ahead for Adventist Health and Rideout, and what it truly means to be made for more. Chris Champlin, thanks so much for being here.
Thanks, Nick.
Of course. First off, how are things?
Things are great. Life is good personally. Life is good professionally. Life's good.
Awesome.
Very blessed.
Glad to hear it. Very glad to hear it.
Thanks for asking me.
You say personally, and I kind of wanted to start there because for anyone who isn't familiar with you, I wanted to give them a chance to get to know you a little bit. Can you tell us a little bit about yourself, maybe your background, what you're interested in, things like that?
Sure. How far back do you want me to go?
As far back as you'd like.
This is one of those, what did you do on summer vacation? You're like the first day of summer vacation. I grew up on the East Coast, Massachusetts specifically, and I moved to California in 1979 or 80, somewhere around there, to go to college and become a doctor and cure color blindness, because I'm colorblind and I thought that would be a good life's ambition. Didn't do either one of those things in my career, so maybe I failed from that perspective, but I moved to California and I met a truly wonderful lady and we got married, and she was from Hawaii. I was from Massachusetts. California was midway. So we have lived here since the early 1980s, and we raised our kids here. Professionally, since I didn't go to become a doctor, I got into public health actually early on. Loved it. It was completely by accident. I had a professor my senior year of college asked me if I wanted to do an internship, and it was the summer between college and med school. And I didn't have anything really lined up to do. I was working construction at the time. So I said, yeah, I'll come do it. And I ended up loving it, Nick. It was like such a cool thing. So got my master's degree instead of going to med school, spent 13 years in public health, worked for a couple of county governments, worked for Indian Health Services. Then I got recruited to go to Anthem Blue Cross. This was mid-1990s at that point in time. And that was when California was transitioning into away from fee-for-service Medi-Cal into managed Medi-Cal. And so I was with that team for 5 years, and then I left there and got into hospital leadership. So since 2000, I've been in hospital leadership, spent all of that time with two organizations. It was Catholic Healthcare West at first, that became Dignity Health, and that became Common Spirit Health. And then here I am at Adventist Health now for the last 3 years. And I had to say, I love this. I love this organization. I love the faith-based orientation, the mission, the vision, the values, and when those mission, vision, and values align with your own personal values, it's pretty cool.
I've spoiler alert, this is not the first time we've talked, so I know how passionate you are about our mission and about healthcare in general. And I wanted to touch on something just quickly here. You said that public health really spoke to you, and there was something about it that you really loved. Is there something specific that really drew you to it? Thinking back to, your first introduction to it, was there something about it that really made you say, this is for me?
It changed over time. So when I got into public health, I was very young, new professional, just finished getting a master's degree, and I was going to go change the world, right? I was going to do this. And I have to say, it was kind of about me, and I was doing a lot of lecturing and writing, and it was pretty ego fulfilling. I was doing a lot of lecturing around the nation. But really, really quickly, it was the idea that you could make somebody's life better. I mean, like public health, this is where the dark shadows of like just poverty, they cast their shadows in a lot of this population. And to see people who have maybe even given up hope for themselves come out of that experience, a changed person with a new light. And man, you talk about changing who you are. And I would say that was probably the turning point in my career, and it was pretty early on when it was more about what can you do to make this world a better place for those people who are living in those long, dark shadows of poverty and hopelessness.
Yeah.
Honestly, that's what just made me stay for 13 years.
Yeah. I mean, that sounds like it really was something that spoke to you and really became your calling. And I like what you said there about, what can you do to make this world, these people, communities, better places to live. Which brings me to Rideout. 3 years ago, you said, started here as the CEO and president. What was it about Rideout that seemed like the right opportunity for you?
Exactly that, which we just talked about. It's no secret, Rideout's reputation wasn't all that good a few years ago, and it was that performance, not just reputation, but the performance of the hospital, both clinically and financially, that forced the board at that time to seek affiliation with a larger entity. And I mean, you have to give credit to that team. I know they looked at a lot of different entities to affiliate with and chose Adventist Health. So when I was contacted about leaving Dignity Health, Common Spirit Health, and coming up here, I took some time and looked at it. Eric Stevens, who was my boss, and in my opinion, truly a brilliant human being who has those same passions, was able to articulate a vision that I was like, man, that's me. That's where I want to be. And that doesn't mean that Dignity Health was not there either. But sure. I will tell you, I spent 20 plus years with Dignity Health, and I had found a home there. That being said, the challenge of taking a community hospital that had miles and miles and miles of potential that was unrealized, it was too good of an opportunity to turn down, I should say. So, yeah, I grabbed the opportunity, came over, and I look at where the hospital is today versus where it was even 3 years ago.
Yeah.
And we're not at the top of the hill by any means, but I just love seeing the progress that we've made.
Yeah, definitely. You used the word potential there. I'm going to hold on to that word because I want to touch on that later. And we do have some hospital-centric things that I do want to talk to you about. But I did want to ask about how much you knew about this community going into things, kind of what was your perception of the area. And then I know that you've really found roots here very quickly. You've made the effort. You've met the people. You've tried to do everything you can to really be a part of this area. What has the reception been like?
Oh, it's wonderful. Kim and I, my wife Kim and I were at the grocery store not too long ago over at Rayleigh's over in Yuba City, and 8 people stopped us like, "Hey, Chris." And we were just, I think it took us probably, I don't want to exaggerate, maybe an hour to like pick up a few things. But what a cool thing.
Yeah.
Right?
Yeah.
They were all people that we know. It was fun. And where you don't get that in the city where
Right.
people are, keep their head down and run past you and don't even want to talk to you. But, to be able to go to the grocery, what an example, right? Be able to go to the grocery store and just see friends and talk. And everybody had, a question about the hospital or just, how you doing? But you asked about, what I knew about the community. And I will say not a lot. One of my dearest friends, Dr. Raj Bhatia, Punjabi doctor down in Ventura, where I spent a lot of time, was like, yeah, Yuba City has a really large Punjabi population, a lot of Sikh. And so I knew that.
Sure.
He told me there was going to be some really good Indian food. So I was looking forward to that. I had, driven past and through Yuba City on the way to Chico many times.
Right.
But really didn't know a lot about the community.
Yeah.
And who was here. But when I interviewed for the job, the first question that the board asked me, and I think it was Steve Krager that asked me the question was, or maybe it was Robert Gangler. I'll have to go back and ask them, will you move to the community? And I said, if you'll have us. And they were like, yeah, we'll take you. We'll let you in. But they have put their arms around us in a way that I couldn't have imagined. And I grew up in a really, really small town in Massachusetts. We had more cows than we had people. So I get, right, small town. And Yuba City and Marysville are both sprawling metropolises compared to Athol, Massachusetts. But they still have that come be part of us. You're welcome. So whether it's them or anyway, yeah, it's been great.
Yeah. Yeah. There's something really special about that, about having the people that care for you being neighbors, being people you see at the grocery store. I mean, there's a different level of care and kindness that's associated with that. And it's a really cool thing to be a part of, even from the non-clinical side.
Well, I mean, so yeah, again, spoiler alert, Nick said that we've talked before, right? We were at lunchtime Rotary today. Yeah. And we were there, I don't know, half an hour early. And how much time did we talk about gardening?
Skiing.
Right?
Yeah.
And how many people came up and said, Chris, we're going to help you with your garden, right? Here's what you got to do. You got to put chicken poo, right? Because that's going to get right watering. And then we talked about making chickens lay eggs. And so, Lindsay, we got some advice for your chickens to lay eggs. So, but that doesn't happen
right
outside of a community like this.
Yeah.
And you know what I love about this most, Nick, is this community loves to love the hospital.
Yeah.
Right? I mean, they want to love the hospital.
Yeah.
And, in fairness, we didn't give them a lot of time and a lot of reason to love the hospital for a lot of years. But boy, has that changed.
Yeah. Absolutely.
Yeah.
I did want to ask you about the namesake for the podcast, Made for More. It's a slogan, it's a tagline, it's something that was introduced by our system, by Adventist Health, but it really extends down to Rideout as well. And I wanted to ask you about what that means to you. What do you think it means for our hospital and the way we conduct ourselves? And then personally, what does the idea of Made for More mean to you?
Yeah, it's a great question. I probably shouldn't confess to this because I know that this podcast is going to be listened to
Millions of people.
by millions of people.
Yeah.
Probably become a TV show before you know it. When I first was introduced to Made for More, I was like, what? Made for more what? I said, does that mean that we're not living up to our commitment? Like you need more from us?
Yeah.
And over the years, it's become a cry for us, which is live up to your potential, right? And you said you're going to hang on to that word potential. And there I am using it again, but we're made for so much more than we often give ourselves credit for. We're capable of doing so much more than we often do. And I think lots of times we take the easy road. We allow life to give us excuses for not meeting our full potential. And, and for me, it's that promise that we make to ourselves that we're going to live up to our fullest potential. So very specifically, what does it mean to me? I've shared this pretty openly. My goal for the hospital is that we're going to be the number one community hospital in the nation. And I was recently interviewing a chief medical officer candidate to replace the irreplaceable Dr. Hurd. Dr. Hurd, if you're listening to this, I'm still mad at you for leaving. And the doctor candidate said, why do you want to be the best community hospital in the nation? And I was tempted to be a little bit sarcastic and I was like, well, because why wouldn't we? Like, would we not live up to our potential, right? Would we knowingly do something less than fulfill our potential? Fortunately, I didn't answer it that sarcastically, but I just said, listen, the reason why I want to be the best is because we have the capacity to be the best. And because we have the capacity to be the best, we owe it to ourselves to be the best, to be made for more. We owe it to the community. We owe it to the community we serve. I think about, you were talking about sports earlier. Did Michael Jordan, and name any of the greats, right?
Yeah.
Did they train to be mediocre?
No.
Did they train to be just okay? No. Right? These are all human beings with massive potential that took the opportunity to fulfill that potential and drive to greatness. And then for me, that's the same thing. We may not be in the sports world, we may not, but we're in the world of making people's lives better. And man, we will be the best at it because we can be.
Okay. Well, as promised, some hospital-centric questions for you. I wanted to first start with kind of a semi-state of the union for Adventist Health and Rideout. How are things for our hospital in 2025? What goals have we set for ourselves this year? What challenges are we facing? How are things?
Yeah, great questions, Nick. Well, I won't sugarcoat it. The state of healthcare in the nation is tough. This is a tough business, right? We have a lot of government payer patients, which, it's tough to make a margin on that business. And I think it's important for our listeners to know that Adventist Health and Rideout is a not-for-profit organization. So what does that mean? The money that we earn that is over and above what it costs us to run the hospital gets dumped back into the hospital. It buys MRIs, it buys CT scanners, it replaces operating rooms that are older and need new lighting, or it buys robots for like a whole bunch of things, right?
Sure.
So one of our goals this year is to get to the place where we're covering all of our expenses and we have a margin that we can sink back into investing in the hospital. Some of those things that I just mentioned are all things that we need.
Sure.
But, with the state of payers being what it is not always easy to make enough of a margin to cover all your debt. We made a lot of investments last year in personnel and salary, wages, and benefits, and we got to keep up with that. So one of our goals is to be able to stand on our own 2 feet financially, not have to borrow money from the system to keep the doors open. I shouldn't say it that way, but to reinvest in the hospital. So number one, obviously to recruit more physicians and more providers to the area. The more doctors we have working here, the more nurse practitioners and PAs we have, the more access we create. This is a national issue. It's not just us, but I kind of feel it very acutely. We just need more doctors. And you've heard me joke in the past, if you've got somebody in your family who's a doctor, go get them, bring them here, kidnap them if you have to. So goal number 2, bring more doctors to the community, bring more providers to the community, open more clinics, ride the financial wave that we've been creating over the last 3 years, and be able to create enough of a margin to reinvest in the hospital.
Yeah, definitely. I was going to ask you a question about access to care, because that is something that's always at the top of anyone's mind in any community. Can I be seen in a timely fashion? Do I have the ability to get the care that I need? And I think you answered half of it or most of it right there with the idea that we do have the aspirations to continue expanding, continuing to provide better access to care. We just need the people, the physicians, the dedicated individuals to be able to do that.
Yeah, right?
Yeah.
I mean, it's not a matter of, can we build, buildings? Sure, we can do that. But if there's nobody to see the patients, that's really where the restriction point is, the choke point, if you will. So, today access is really a factor of, do we have a provider? And some specialties, where the number of providers is either 0 or 1, access is really an issue. I mean,
yeah.
you might take 6 months to get an appointment. It's not because we're doing anything nefarious. It's just there's no one there.
Right.
There's one guy or one lady just working their buns off trying to see as many patients as they possibly can. Other specialties where there's more and more of them, then the access is easier.
Yeah, definitely. I wanted to ask you about one of the initiatives that's been something that we've been pretty passionate about over the last year, Project Hope Minor, the project to establish a 22-bed sobering center off of property on Garden Highway, I believe. It's something that has the potential to provide a lot of really important resources for parts of this community, including things like medical recuperative care, housing navigation, a lot of other really essential resources for, some marginalized parts of this community. I want to ask if you had any updates to share as far as Project Hope Minor is concerned.
I do. So Project Hope Minor is rolling along. I don't quote me on this because there's always things that happen in a construction project, but it should be open June timeframe. 24 beds, post-hospitalization, recuperative care. That was one of the biggest things that we could do to help free up the emergency room. Listen, I know everybody always, when I get stopped in the grocery store, it's like, Chris, what is going on with your emergency department, right? And everybody knows it's not a secret. We have a lot of behavioral health patients that come in, and we're not a psych facility. We're a medical facility. They're very different kinds of medicine. So, giving a place for those people to go, a safe discharge. That's really what that's all about. And I would be remiss if I didn't, mention it. This is always dangerous because there's been so many people.
Right. You don't want to forget somebody. Yeah.
Right. But, I think about Mayor Branscombe here and City Council Member Gilchrist, here in Marysville, Gary Bradford on the county council, right? So people
so
here,
many individuals.
Right? I think Mark Boomgarter on the other side, and Dave Shaw, and just the list goes. Carm Baines, right? I'd be remiss. Dan Flores, if I didn't say those names, who have just been behind this 100%.
Yeah.
Helping us out. Our own board members, Jackie Silman,
right? Steve
Krager. Again, that list goes on and on. So, but if I forgot any names, you never do that. But the point of that is so many people behind that who have been supporting it and helping us to go where we need to go. So June timeframe, expecting it to be open.
Yeah, I've attended a lot of these city council meetings with you, and just to see the uniform support, like everyone knows that this is something that is going to be really important for this community. So it's great to see that kind of rallying behind something like this.
I love that rally.
Yeah,
that's exactly what it is. I mean, both city councils, both county councils, county supervisors, cities, individuals, boards, everybody's behind it.
Yeah, definitely. Chris, I just have a couple of last questions here for you. I want to ask you about maybe taking a moment to reflect on what the past 3 years have been. And this is where that word potential comes back into play. Because when you got here, there was a ton of potential for this hospital, and I think there still is. But I don't think I think it's pretty fair to say that we've realized a really good amount of that potential.
Yeah.
What has it been like? What has it been like seeing this change? It hasn't happened overnight, but the hospital has seemingly turned a corner, at least in the eyes of a lot of community members who have, really had great experiences in these past few years.
Thanks for asking that question. I mean, you're in it on a daily basis, and we tend to not take the time to reflect, and I think it's important. I mentioned Eric Stevens earlier, who's just a brilliant human being, and we were in a meeting recently, and he said, I know sometimes it feels like the Greek myth of Sisyphus, right? You're pushing a rock up a hill and you never get to the top, and you're overwhelmed by inflationary salary, wages, and benefits, or cost of equipment, or cost of supplies, and you don't give yourself the time to stop and reflect. And like I said a minute ago, it's important. So as I reflect on Rideout, the one thing that is most impressive to me is our associates. If you go to the hospital, and I bet you'll relate to this, but you go to the hospital and you walk in the door, you will be immediately struck by a vibe that wasn't there 3 years ago.
Yeah.
There's energy, it's in the air. People are smiling, they're walking upright, they're smiling, they're laughing, they're engaging with patients. One of my favorite things to do is go round, which for our listeners is going out and just talking to people. Our entire executive team does that. And as I'm rounding, the vibe for the associates is way, way different. The patient gratitude, I don't know that I can measure the improvement in patient gratitude from 2002 when I got here to 2005 today. It's just off the charts. Well, actually, for those of our listeners, Nick tracks a lot of our online reports. And you've seen it, right? I mean, it used to be, don't go there, save yourself. And now it's my eggs were cold. I'll take that.
Yeah,
any
if that's
day.
the worst complaint, then
Yeah,
yeah.
I'll take it. So we're in a much better place. I think just in terms of associate engagement, community engagement, our quality scores, our safety scores, our physician engagement. It's just so much better. Okay, here's a real score. We were at a 2 in our online Google ratings.
Yeah, it was in the low 2s. It was not good.
Yeah, right. And we had just a few people and they're all haters.
Yep.
And I don't mean that unkindly, but they were going to tell somebody about how bad their experience were. Now we have 2,000.
2,000. Yeah.
2,000 people have taken the time to make comments, and I read them all, and man, there's so many positive. So as I reflect on the last 3 years, I love to see the engagement of our associates and this sort of belief, not this sort of belief, this belief that everybody has adopted that we are going to be the best.
Yeah.
Like we can get there. We have the potential, and we're going to roll. We're going to keep going.
Yeah, absolutely.
Yeah.
Just to put a button on things here, Chris,
All right.
If there's one thing from our discussion today that you would want the listeners out there, the community, to take away, something that one singular final message, there's a lot we've talked about, but if there's something you want them to take away from today, what would it be?
Yeah, I would say thank you. A word of gratitude from me to our community for continuing to believe in us. Your belief in us, your support of us is the energy that fuels us to be the best, to continue our journey to being the best, and we need that support. Thank you for putting your arms around us. Thank you for loving us. Thank you for supporting us. This would not be the same without that support. So what I want you to take away is that we appreciate you. We have significant gratitude for your support of us, and help us keep going in the direction. We are a new hospital, and I hear that so many people. We are the new Rideout. I hear that in grocery stores. I hear that at Target. Like, have you seen the new Target? That's a partnership between the community continuously encouraging us to be the best and us having the same goal. So thank you for making us who we are, and keep on doing it. Keep on using us and keep on supporting us.
Yeah, absolutely.
Yeah.
Well, Chris, thank you so much for being here. Thanks for being the very first guest on the Made for More podcast.
Do I get a button or something?
Yeah, you'll get a goodie bag to go home with.
Goodie bag, yeah. of hospital swag.
Yeah.
Probably from my secretary.
All right. Well, yeah, thank you so much.
Nick, thanks. This is going to be a great podcast. I'm sure that future guests will be just as good, if not better. And this is going to be a good thing for the hospital. Thanks for hosting it.
Happy to do it.
Yeah, good. All right, thanks.
Thank you. All right, that's a wrap on the very first episode of the Made for More podcast. A special thanks to Chris Champlin for coming on today and sharing with us his vision of growth and innovation in our community as we strive to provide the best care possible for those we serve. If you like this episode, please be sure to like and subscribe, and stay tuned for so much more of the Made for More podcast. Thank you.